Hello and welcome to We Women Want. This is our weekly show for women where we celebrate the achievers and we also try and help those who need us. Sometimes we also talk about health issues, whether it is breast cancer, whether it is IVF, whether it is just menopause, all kinds of issues. But today we are going to be dealing with skin care, because that is something I think every woman or even every man nowadays has a problem dealing with, how they want to look, or just a healthy glowing skin I think is really essential. And skin is something that is actually the most vital organ of our body and the most I think under talked about. So today we are going to be focusing on that. I have two very eminent guests with me. I have Dr. Priya. She is with the Kerala Ayurvedic Center and she is going to tell us Ayurvedic remedies. And of course, I have Dr. DEEPALI BHARADWAJ. She is a dermatologist and she also has her solutions. But Dr. Priya, did I get the name right? Kerala Ayurvedic Center?
Yeah. Kerala Ayurveda.
So can you first tell us what you do at your center and in terms of just for options for skincare and.
Okay, so Kerala Ayurveda Limited, it is a full spectrum company. It is a clinic. We are based in east of Kailash, wherein we do all the clinical therapies like Panchkarma, all the therapies, massages, skincare, cosmetology. So that's what we mainly focus on. That's about it.
DEEPALI, tell us about your clinic.
As a practicing dermatologist now for more than 13 years, and I'm also based with Max Hospital at Saket, we first like to see the skin and we like to correct it, especially for people who've been following a lot of Instagram, the Gen Z basically, and spoiling their skin by using active ingredients, just buying them left, right, center over the counter. So that's what I've been doing for last few years. And of course, we are treating a lot of growing skin allergies, which is due to the living in the most polluted city of the world, New Delhi. So of course, that's on the rise is what I've seen. Even on the spectrum rise is the skin cancers. So as a dermatologist, yes, we are dealing with all this beside, of course, a lot of cosmetology and hair transplants and removing hair for ladies. So it's a mixture of everything.
Fair enough. But she highlighted a very important point, is these quick Instagram solutions, instant solutions that Gen Z really talks about. But instead of chemical options, what Ayurveda does is offer natural options. So if you can tell us, for instance, some quick fix solutions that we can do at home also, or that we can do at your place.
Okay, let me tell you, like in Ayurveda, skin is a wide concept. So it's the largest organ in our body.
Correct.
And when we say skin, it's not just the facial skin.
Good point.
You have your scalp, you have your dark circles, you have your chapped lips, you have your cracked heels. Okay, so skin is actually a reflection of your internal health. So the treatment, when you see home remedies are very temporary, like they're short-term remedies. When you look at skincare in the long term, you need to do a deep cleansing of your system. So that's what Ayurveda does, is we know you have everything, we work on the dosha basis. So for example, we have different skin types. We say normal skin, dry skin, oily skin. So these are all related to certain doshas. Say for example, for normal people to understand, when you say a vada kind of a skin, it's kind of more dry, dull, flaky kind of a skin. Now pitta is a seat of fire, we say. So that will have a lot of oily and allergy prone skin types. Like you can get easily suntanned and sunburned. Lot of inflammatory acne, allergy, so that is under pitta. Now there's another category which is kabha, which is again like more glossy oily skin, but they are more prone to whiteheads, stubborn cystic acne, water retention, puffiness. So based on these doshas is what ideally the skin care is taken care in Ayurveda. There are a lot of herbs in Ayurveda, a lot of herbs are mentioned for Kanti Vardhaka, which is like enhancing your complexion. Then there is a set of blood purifier drugs. So this is related to blood purification. So working on your metabolism, working on the liver health, working on external and internal moisturization. So all of these cumulatively will give you a good skin if you're looking at a long-term benefit.
So its skin is internal as well as external. So do you also offer like maybe nutrition tips, diet tips, or?
Yes. Of course, as she rightly said, that skin is the largest organ. It's like a mirror of what's going on inside. So if you have any nutritional deficiency, I still remember years ago I saw a patient, she was bleaching her fingers at a beauty parlor, visited a lot of other people also, and I just did her blood test. So it was vitamin B12 and iron deficiency, which gives you pigmentation here. Around the lips, it's very common. The pigment happens because of course, the lipstick allergies and also B12 deficiency. So you have to check your parameters. You have to keep everything inside right and have a healthy lifestyle. Ayurveda, of course, should be a part of your life. I personally also like to practice it. That's how you will have to scientifically live for a good skin. There's no other way.
They are
feel.
not there. Okay, so I've been to actually both your clinics, but in terms of face packs and other stuff, what would what are the options that you look for, and what are the options that you look for?
Okay. So in Ayurveda, as I told you, very important. Total cleansing is what we focus at. Local packs, facials are there with a lot of herbs, like I said. You might have heard about red sandalwood, there's white sandalwood, there is vetiver, there is saffron, different types of turmeric, there's a tree turmeric, there is a regular kasturi haldi. Then you might have heard about muleti. So these are certain drugs which are actually mentioned in the classical textbook, which fights with pigmentation, blemishes, and things like that. Now there are so many external therapies like Abhyanga. I always say moisturizing, as you age, especially after menopause, the oil content in the body is very less. Your skin tend to get very dry and itchy also. So regular massaging with medicinal oils are there, or any oil for that matter, which is a feel good oil for you. You need to regularly massage and moisturize your skin. So as such, the skin will maintain its elasticity, improve your blood circulation, reduce that puffiness and water retention. So Abhyangam or massage is one way. Then there is medicated milk bath on the body. Your eye health is maintained. Then there are powder massages to remove water retention. So therapies are many.
What does medicated milk do?
It is for nourishing, it's for a lustrous skin. It also gives neuromuscular strength. Apart from that, initially when there is a patient who has a long-standing problem with stubborn acne and all, we go for a cleansing, complete detoxification. That will include a Panchkarma procedure known as Virechan. Virechan is like purging out in normal term. And then there is Vasti, which is a enema therapies. And a very cleansing, liver cleansing diet is given for 7-8 days, a little stringent, so that you are cleansing your system, you are rebooting your metabolism, working on the immunity and your liver health. So that long-term benefits ke liye we'll be doing this detox therapy. And then of course, as I told you, all the external therapies like massages, milk bath, and there is facials, all of those local application is done also.
So for a normal Indian skin, what are your treatments like?
See, there are various treatments. There are different kind of medical facials. There are different kind of hydrofacials. And interestingly, the hydrofacial which we dermatologists do is actually a pure hydrofacial. That's like a name of a machine. And I would like to use your platform to inform people that a lot of beauty parlors are selling hydrofacial at the same price as us. And how you must have seen, a lot of people may have forgotten, but in Bombay there was a girl who was burned, and for 6 months she was fighting, and she had to postpone her wedding. And it was all over across the medias, because at a salon, at a very hi-fi salon in Bombay, she paid 18,000 for a hydrofacial to get burned. So please don't indulge in these kind of dermatological treatments at a beauty parlor, is what I would like to request. The facials which we do are with active ingredients. My friend here, colleague here, rightly said about the Ayurvedic stuff. Of course, that's very good. But if you're trying out something like alpha hydroxy acids and beta hydroxy acids, and you want to get vitamin C infused into your skin, there should be a trained dermatologist, because even infusing purest form of vitamin C can lead to allergies.
What is a hydrofacial?
Great. Hydrofacial is something, it's like a brand. It's like a Louis Vuitton in facial. It's a name of a company. It's not, and it has different steps of a facial. I have a hydrofacial machine. And of course, a single hydrofacial treatment to the doctor is quite costly, because we have to infuse active ingredients, infuse oxygen, infuse vitamin C. So there are different medical facials. The main steps which we dermatologists do is basically mesoporation. We have a certain machine, just say whatever you're applying on the face gets absorbed. It goes in deep into up to say 150 to 200 nanometers depth. So which is quite deep. Okay. So then of course we have machines like lasers, which will go straight to wherever we target, be it water, be it pigment in the skin. So we have Q-switch laser facials with it. Hydrofacial is something which has become a very big brand because of the advertisement by the company and by the people and Instagram generation. But you should check if you're actually getting a hydrofacial, the machine should have hydrofacial written. When it's switched on, it will say hydrofacial. All those facts should be there. There should be 5 steps involved. You should see that the ingredients put are open in front of you. They're not again and again being used, unless it's a facial which is being done on a daily basis. You see the clinic is full of people, then it's still safe. So there are lesser chances of infection. But now, as a practicing dermatologist and especially being an allergy specialist, I am noticing a lot of people developing allergies, which is really sad to see. They are developing sensitive skin at a very high speed, especially in New Delhi, and even in Uttarakhand side, because I visit AIIMS Rishikesh, I am noticing, but really high in Delhi, which is very sad. And I think that's because of people misusing these treatments and buying active ingredients, which is easily available in India over the counter.
Yeah, so another problem that a lot of people have is puffy skins, or when you wake up you haven't slept, or you slept too much. So is there something that you would offer, recommend, चाहे घर पे home remedy हो या
Yeah,
आयुर्वेदिक.
it is a very important is sleep. It's a beauty sleep. We know, we need to sleep 7 to 8 hours to reduce the puffiness naturally. Your skin will have an internal glow if you sleep well. And overexposure of sun. And one thing which I would like to add is here, like misusing the remedies. Our natural therapies, everyone thinks ki lemon, turmeric, saffron oil, any and everyone can apply. Lemon is very acidic, it is sensitive to most of the skin types. So you cannot just apply lemon and do the bleaching effect. So you have to be very aware of it. Two things which you can adopt, which is mentioned in the books also, is the Shadadauda Gridam. It's 100 times washed ghee, excellent for skin. So especially after menopause, when you have this excessive dryness on the skin, these are like really minute particles, so they do deep hydration of the skin. So this 100 times washed ghee is something which anyone can use. And another one is Tandulodaga. There's a lot of hype around rice water, doing magic for your face, for your hair. So, but what is preached on this internet and Instagram is absolutely wrong. They do ferment it, they refrigerate it for so many days, and they do it on the face. But it is not going to affect. It's going to be irritating. It can cause rashes. It can cause, because it is fermented naturally, so it will be irritant for your skin. So Tandulodaga or this rice water, which is mentioned in Ayurveda, it is just kept only for 2 to 6 hours, and it has to be used within that day to see that effect. And people are lazy to do that, so they refrigerate it, they use it, but that's not going to do any magic. So that's what I wanted to add here.
Good. So, anything for instant remedies, or just for you want to go out looking good or something, if your skin or dark circle or something, what would you recommend?
For instant, I would just say, wash your face with real cold water or rub eyes on your face if you have pores. If you have pigment, you can put tomato juice. Just slice a piece of tomato and put it on your face, keep it on for 5-10 minutes. If you have dry skin, in the same thing, you can add curd or parboiled milk, of course. So that's going to give you a good glow. Besides this, sunscreen. Sunscreen is #1 important if you want to have good skin. So if you're having early wrinkles, if you're going out to a party, if you're going to be sitting somewhere where there's going to be a lot of lights, please wear a sunscreen before your makeup. That's going to help you prevent wrinkles, pigmentation and skin cancer, which is definitely going to be the next epidemic in Indian people.
In fact, I'm glad you brought up the sunscreen, because that is something that a lot of us are not aware of, the importance of sunscreen, the dangers of skin cancer. So you, just one quick thing on the sunscreen, you recommend that one should use it, like before going out, before sleeping, or just before wearing makeup?
Sunscreen has to be applied, say, about 10 to 15 minutes before going in the sun. For Indian skin, anything SPF above 25 is fair enough. If you're going to be in harsh sun, say harsh sun is basically between 11 AM to 1 PM, between 3 PM to 5 PM, because that time the UVA, UVB, UVC all are very high, especially in the northern part of India. So in that case, you need to reapply the sunscreen. Even if you're wearing makeup, you can reapply sunscreen on top of it, or you can buy a powder or a spray sunscreen which will not spoil your makeup. So if you're a man and you just have applied sunscreen and you're again in the sun, then it's a good habit to reapply sunscreen before lunch. I would like to add, the quantity of sunscreen has to be, I'm sorry, but I'm really a huge fan of sunscreen, because I think we should ask her how to eat sunscreen, with which I mean that you have to even eat antioxidants, which will help you fight the sun rays internally. So that is also, there should be a timing ideally, like I personally try to have at breakfast, food items in my diet, which is going to help me fight with the sun rays and the harsh chemicals and pollution, because that's when I'm going to be exposed. At night, it could be a lighter meal. Similarly, for your skin, you have to wear sunscreen. Your finger is divided into 3 boxes, 1.5 fingertip unit. That has been scientifically, American scientists have proven. This is the quantity of sunscreen everybody needs. 15 minutes before going in the sun, after every 3 hours, it has to be reapplied.
Some Ayurvedic option for sunscreen?
Yeah, it's all about nutrition we are talking about. So you have to watch your diet mainly. So we need vitamin C, vitamin D. It all comes from fruits and vegetables, healthy fats. There is buttermilk, there is black sesame seed, there are roasted black raisins. We always talk about it, coconut water, pomegranate, foxnut. All these things make a healthy nutrition. And I have to add here, in Ayurveda, we have a certain food groups which affect skin abruptly. For example, excessive intake of jaggery. I'm talking about excessive intake. Excessive intake of jaggery, salt, spice, sugar, and fermented foods. So these things, and also curd, like if you are having an inflammatory, your body is already very heaty and you're having acne and inflammatory acne on the body, avoid all of those heating foods. So these set of foods can be kept aside, and you have to work more on cooling foods. So that's about it. And as I told you, sleep is very, very prime. I always reiterate on all my patients also. It's something which we disregard. You need to sleep well so that all your internal structures are repaired and for your overall well-being.
Okay. Here we talked about normal skincare more or less, but I'm going to now after the break ask them what specific cases, specific cures that they may be offering for specific ailments, but after a quick break, so stay with us. Hello and welcome back to We Women Want. Today we are focusing on skincare, and skincare is not just beauty is much more than skin deep, as we were discussing. Dr. DEEPALI, is there anything, for instance, do you offer, for instance, autoimmune disorder or options like that? Are there any cures that you can offer?
Definitely, there are a lot of options now. Science has definitely, evolved immensely, especially in dermatology aspect, I would say. So, see, autoimmune disease, anybody needs to understand, automatically your immune system is spoiled. So, you need to strengthen the immune system, ensure you don't develop other autoimmune disease, because they are like brother sisters. That's what I say. If you have one, you will develop another. Every decade, it could be a unfortunate gift to you. So, there has to be a combination of Ayurveda, homeopathy, allopathy is what I have always told my every patient. So, say if you are having an autoimmune disorder like psoriasis or lichen planus, they are both totally different spectrums. So, if you have psoriasis, there is a certain diet we give. We give you a skin allergy things. We tell you to increase omegas in your diet basically, and you need to inside out nourish and moisturize your skin, and of course outside in nourish but also exfoliate, so that the dead skin, those white patches are reduced. Unlike in lichen planus, the more interesting aspect is that you have to curb itching. If you're going to be itching and you're not able to control it, it's going to spread all over the body. But most important lesson that I've learned over the years of practice is that all autoimmune diseases can be genetic, but are related to stress. So, one has to work on lifestyle. You listen to me, you listen to homeopath, you listen to an Ayurvedic specialist. You have to change your lifestyle and live a cool, happy life. You have to do something which is going to make you feel lighter, which is very important.
All comes down to state of mind, as you said. But do you have anything specifically for, say, autoimmune and?
Yes, just like doctor said, in psoriasis cases, main is cleansing. That I said, detoxification of the system is done. There is another Panchkarma therapy called Vamana, where you induce vomiting, which is as a balancing the Kapha dosha. And then we do a specific therapy called Takradhara, which is the processed buttermilk bath on the body. It is excellent for healing the flakiness and reducing the marks on the skin, which is the go-to treatment for psoriasis that we do. And of course, there are food restrictions, which I said, no excess jaggery, excess salt, all this excessive intake of sweets, fermented foods, curd, fish. Certain food diet habits are also there, and we ask the patient to restrict on these diets. And recovery rate is very much, of course it is a stress induced condition. So, whenever there is a stress or when there is a weather change and your immune system is a little shaky, where your immunity is a little shaky, you will tend to have flare up here and there. So, working on that immune system, working on your stress is very, very important in this case.
What about lupus, and what are the other skin disorders that people come to you with?
See, I see a lot of urticarias, which we do skin allergy test, and we make vaccines, which few people are doing in India, but they give fantastic 100% results. In psoriasis, we give biologics, which are certain injections, which are all manufactured in Germany. I hope one day we'll be manufacturing in India with same quality. And besides, we give certain immunomodulators and medicines, which will change your immunity so that you can fight with the disease better. I see a lot of melasma, unfortunately, and that's growing in men, because we women can still handle things, but when it happens to a young guy, that's another thing which I've seen increasing. And men were earlier just coming for hair fall, and interestingly, if I can add, that they always come for hair before their marriage, and after marriage they're quite okay with it. I've really seen it at least in 1,000+ patients.
I'm glad it's the men who get a little stressed out also, usually it's the women.
Yes, and now they are even more, they have that craze, thanks to the misfortune, though I call it, the Instagram, that people are coming for a lot of glutathione injections. Everybody wants to go fair.
What is that?
That's the new fad, that everybody wants to become fair, and they believe that they can all look like Aishwarya Rai if they have some money with them. They can spend 1 lakh and they become fair. That's such a false statement, unfortunately, which is across all over social medias. You cannot become fair, more fair than what your color is behind the ear. So, if you meet a good dermatologist who is experienced, can give you this color for your whole body. You cannot become fair than this, even if you spend crore of rupees. That's number one. Another beauty trend which I am seeing is, a lot of people want that Korean glass skin, for which they will do different treatments. And I meet patients who say, doctor, you've only given me 4 things to apply in a day, and I apply 4 in the morning, 4 in the afternoon, 4 in the evening. So, I think overdoing is really going to lead us nowhere, and it's going to spoil our skin in the long run, because we need to remember we are not living in Korea, we are living in a lot of pollution, a lot of stress, and we need to not use too much of toner. Indian skin should not use too much of toner. Even if you have a very oily skin or a dry skin, excess toner is bad for you. You should maybe do it maybe thrice a week if you're in the habit of what we used to read earlier, CTM, cleansing, toning, moisturizing. But that's not what's needed right now.
Fair enough. What are the ailments that people come to you with? Skin ailments?
Similar case, all those
All
urticaria,
those.
food poisoning, urticaria, rashes, psoriasis. Psoriasis is what everyone knows about it, that Ayurveda has some quick fixes and some long-term benefits to it. So people do come for psoriasis, and mostly I deal with acne and hair care. So it's mostly different kinds of acne and things like that. Pigmentation and melasma is another thing. Everybody going
Wants
through
to
the
look.
pollutants, everyone, most of them have, even before 40 I think, now 30, 35 also they have this melasma, pigmentation, freckles, pigmentation on the face. So I can tell you a few herbal remedies that you can do, like more which is not like herbal home remedy, it's little medicated ones.
Yeah.
So you might have heard about the licorice and the mulethi. You can add sandalwood to it to balance out that little heat in it, and also add ashwagandha powder. So in cold milk you can apply it on the face. Now the base will depend on what kind of a skin you have. If you're very dry, even ghee is good. If you're already oily, applying ghee or oil would further flare up the condition. So the base, whether you use rose water or you're using honey or you're using cold milk or using ghee or egg white, all of these things should be based on your basic skin type. So this is something which you can try for the pigmenting aging skin. Ashwagandha is known as a Vaisthapna. I mean, it's an anti-aging drug which is mentioned. Also Gotu kola. So these things can be added in little permutation combinations, and you can apply it on the skin like once or twice in a week. Not to see that magic, but of course those blemishes, the new ones, can be arrested and will fade off the uneven tone of the skin.
Okay. But even, for instance, hair fall is something that she flagged off. That's something a lot of men, women have an issue with. So is there some oil, we've always said, somebody saying coconut oil, somebody says olive oil, somebody says this oil, that oil. So is there?
This is something, everybody asks, is there any oil for hair? It's not. See, hair fall is due to so many reasons. You have to see to your internal health every time. It can be hormonal issues, it can be nutrition deficiency, it can be iron deficiency, it can be, local application of harsh products on this hair. So you have to address what cause it is, and accordingly we can decide whether, what oil.
Hair dye, a lot of people are facing, the fallout of that, of harsh hair dye or something. So is there something that you, and then I'll ask you also the same question.
Yeah, there are products in market like indigo. It gives natural, and there is Avla, it has a natural black resin in it. So it gives a dark color to the skin. Not that it will reverse the graying, but then it can have that pigment on the hair. So it is included in a lot of hair dyes. Now Avla is there, indigo powder is there, henna. So it's a mixture of all of those things which is used as, and there are products available in market which is ammonia free and all for hair dye, organic products.
And what should I look for in the pack? Ye bilkul hi no hai, like ammonia free is one. Anything else, red flags?
Well, it has to be ammonia free, and I would say it has to be indigo free also, because a lot of people have developed allergies is what I've noticed with indigo, and we can't generalize it. And if you have developed graying early, say in your 20s, even if you have a family history, then calcium pantothenate is the drug which actually can reverse your grey into black. Another common reason I've seen is a lot of people using those, advertisements of anti-dandruff shampoo by the top film stars of Bollywood, if I would say. So people use an anti-dandruff shampoo, imagine, on a daily basis. So they develop graying only because of that ZPTO in it. So please don't use anti-dandruff shampoo more than once a week. Even if you have dandruff, it's once or twice a week remedy, not to be done every day. Another thing is the Gen Z is doing a lot of smoking and hookahs, which is leading again to early graying of hair. So because of the smoke and sitting in the hair. So if you have to smoke, I would say please spray water or put aloe vera gel at least as overnight application. And as you asked about oil, as a dermatologist, I'm completely against oil.
I see. That's why you're smiling, right?
And if you have the habit of applying oils, please make a mixture of whatever oils you feel like using. Use it only for an hour before shampooing, thinking it like an external conditioner, not like a magic in the bottle,
So that whole thing, okay, tel laga ke so jao, 4 ghante laga ke dhoop mein baitho, you don't recommend that?
No, because of the changed weather. If you're living in the high altitude, you can definitely do that. If you're living in a weather like New Delhi, then you should not.
No, she is correct, because there are people who have sinusitis, cough, cold, asthma sort of. Leaving oil overnight is absolutely not advised, and also for patients who have migraine. If you have like really frizzy hair, it's okay. If you're otherwise fine, you can leave it on, but I advise my patients to keep it for 40 minutes before shower. So that is how you should be doing. And also, it's not the quantity of the oil that you put on your scalp. It's just that, for the deep penetration and for the conditioning of your hair and for activating those latent follicles, you can do them. And if you don't have hair follicle, you put a lot of oil and do, it's not of any use. But once or twice in a week, if you do a good massage, it will definitely help you have a good hair texture also, growth as well. Yeah.
So what is, everybody says what is the first thing you should put in the morning? What is the last thing that you should put? What should be the bedtime routine be for a
Well, my own
for
bedtime.
average skin?
Yeah.
What is your bedtime routine? Let's hear.
Yes, my favorite and my go-to is for every kind of skin. Even if you have an oily skin, you have to moisturize. Whatever you're applying on your face at night is like food for your skin. So while you sleep and you replenish your energy and you relax and you wake up fresh, same way your skin needs some food. So whatever you're applying has to be nice, nourishing, moisturizing with something which will be like, say if you have an issue like pigmentation, it should be something which will lighten up your skin. So something like arbutin or tranexamic acid or some AHA, BHA. But most importantly, I would like to say, do not use the same product every day. Do not use the same product for a very long time. Say if you like product A and B, you can alternatively use it, then change to C and D after 3 or 4 months and then go back to A and B. We should not get habituated to anything.
Good tips. What about you?
And same, like how said, nighttime routine, the Shadadav, the ghee that said, no, the 100 times washed ghee helps in deep hydration of the skin. So you can use that ghee cream. And as she said, she is somebody I can relate to. She is connecting everything with Ayurveda, so it's good for me.
Actually, my patients say that I actually combine it. Yeah.
So that moisturizing, irrespective of what kind of skin you have, you need to moisturize, especially after menopause. So I said there's a lot of dryness. So you need to address that with hydration, internal hydration, external moisturizing, watching for the sun, and sun photo damage. You have to be watchful about that as well. Yeah, so these things have to be taken care of. Rest all the points she's already said, so follow that.
Okay, so on that note, I think we've given you some good tips for skincare, and any other problems, I'm sure you can reach both of them also. But thank you so much for this conversation, and thank you for watching the show.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.